So still on the basic pharmacology, we're trying to look at hormone, that's adrenaline. We're trying to look at how adrenaline actually interacts with what? Its receptors. Now, its receptors is what is known as adrenoceptors. So how do these two things actually interact? So for adrenaline and adrenoceptors, you can see this is a pictorial representation of what we're about to talk about. So you should know that adrenaline is also known as what? Epinephrine. So it interacts with adrenoceptors. Now these are specialized receptors in the body that are meant for it. Alright? So they actually mediate the effects of sympathetic nervous system. So these receptors are divided into the alpha and the beta. So you can see here that this is a beta adrenoceptor receptors. The alpha one is not depicted here, but let's go to this lecture. This one. Alright, so this is alpha 1 and alpha 2. So it's also a basis of how they also develop some drugs. So we said that these receptors are divided into alpha and beta, which trigger different physiological responses in the body. So for the types of adrenoceptors and their effects, you have the alpha 1 receptors. They are found in the blood vessels. Activation leads to vasoconstriction. Alpha 2, then the central nervous system. Activation inhibits, neurotransmission release. Then beta 1, they are primarily in the heart. Stimulation increases heart rate, contractility, enhanced cardiac output. Beta 2, they are found in the lungs, the skeletal muscles. Activation causes what? Bronchodilation and vasodilation. So beta 2, they are basically opposites of alpha 1. Alpha 1 is for vasoconstriction. But when we are talking about drugs that act on these receptors, you get to understand it better. So adrenaline binds to these receptors, triggering intracellular signaling pathways that regulate heart rate, blood pressure, airway dilation, and metabolic processes. So this makes adrenaline crucial in emergency responses, such as all those anaphylactic shock stuff, where it rapidly restores blood pressure and breathing. But this will be further up. We'll get to still talk about it.